I'm absolutely thrilled to welcome all of you, medical students joining us from all over the world: Australia, India, Japan, Pakistan, Philippines, Malaysia, Indonesia, Hong Kong, Thailand, Singapore, and many more. Welcome. Welcome to our first Global Health Training 1 for 23-24, Evidence-Based Policy Writing Workshop. Joining us today are executive committees, regional chairpersons, representatives from each chapter's National Executive Board, members from each chapter of AMSA International, and of course, the loving organizing committee for this training who have worked extremely hard to put this together for you. Before we begin, let's watch a short promotional video from AMSA International. I would like to request everyone to turn off their camera to reduce the bandwidth for the video to be played smoothly.
The Asian Medical Students Association is a peak representative organization of medical students from numerous nations across the Asia-Pacific and beyond, with its physical secretariat set in Taichung, Taiwan. Founded in 1985, AMSA International has been a non-profit, non-governmental, dynamic organization led by a board of medical students across the globe, bringing together chapters with a directive vision: knowledge, action, and friendship. AMSA International has functioned to promote the interest and welfare of Asian medical students through our knowledge-rich academic subsidiary, our very own academic journal, a robust transcontinental exchange program, our biannual conferences EAMC and AMC, our global health subsidiary, and our quarterly published e-newsletter. Our subsidiaries set out to nurture humanitarian values and medical ethics through a myriad of strategic partnerships. Every year, AMSA International brings together over 500,000 medical students through our activities, cultivating a vibrant international melting pot of ideas and adversities. Our alumni club, known as AMSAC, connects our vast network of alumni, continuing to support them on their journey towards becoming the doctors of tomorrow. To find out more, please visit our website or follow us on our social media.
I hope you all enjoyed the video. Please turn your cameras back on and let's begin with the program. I will be going through the agenda of today. So we are now in the opening ceremony for this session. And at 7 p.m., we will have our first session, which is translating evidence for health policies, which will be 40 minutes long. And at 7:40, we will have a Q&A session for 10 minutes. At 7:50, we will be awarding certificates to the speaker. And finally, at 7:55, we will be filling in the feedback form and have a picture-taking session. For the highlight of the day, we will have a seminar session with a prestigious speaker. You might want to prepare your questions now for the Q&A session, as this might be a once-in-a-lifetime opportunity. And kindly rename yourself as your name, followed by your AMSA chapter. We will now proceed to our next agenda of the day. I would like to invite Sydney Chandra as our Director of Global Health. The screen is yours.
Thank you very much, Florence. Greetings, people of tomorrow. We've heard of evidence-based medicine, but how often do we hear evidence-based policy? Hello again, I'm Sydney Chandra, Director of Global Health for AMSA International in this tenure. It's truly a pleasure to see a large influx of participants showing their enthusiasm for health policy as I envision that we, AMSA members and medical students, can bridge the voice between research and policy for our futures. No matter how smart we are in diagnosing and managing diseases, the fate of our patients in the future are affected by the policies and regulatory context they live in. This is why, in this tenure, we will hopefully bring the AMSA International policy writing to life, as outlined in AMSA International Constitution, by opening a working group to collaboratively write policy recommendations for stakeholders. To build a strong working group, prior experience is needed, and GHT1, Global Health Training 1, is a platform the Global Health subsidiary, provides to allow all members some exposure to health policies. I would like to also thank all Global Health organizing committee, as well as the group moderators who have been working really hard to prepare this event. I would also like to thank WHO EVIPNet consultant, Mr. Davi Romao, who has been willing to be our speaker for today. As information, the guidelines provided in the participant kit are from WHO Evidence-Informed Policy Network. So this is truly a privilege for us organizers and participants. We hope you'll get a thought-provoking experience through GHT1. Viva AMSA!
Thank you for your speech. Next, I would like to invite Vicky Chiang as our Vice Overall Chairperson External.
Hey, hello everyone from GMT+8. Good to see so many global health enthusiastic all together here. I'm Vicky Chang, the current Vice Overall Chairperson External of AMSA International. As global health, or we say public health, is being increasingly emphasized and focused on different aspects of people, it is necessary for us to be equipped with the ability of policy document writing. Therefore, our global health subsidiary this tenure designed a series of policy document writing trainings and events for all of those who are interested in this field. For this tenure, the first global health training, we invited very experienced speakers from WHO EVIPNet and CISDI to give us lectures and insights on policy document writings. I'm glad to see so many new and old familiar faces here online, and hope we could all learn something from this global health training and establish friendship by contributing and discussing together with our fellow members in AMSA in writing health policy recommendations aimed at global health and national stakeholder and any health topics that you are interested in. I believe that everyone have already agreed on a certain global health topic and started on your discussions on your group policy documents. So hope today Dr. Davi's sharing on the topic of translating evidence for health policies will inspire our thoughts. And last but not least, I would like to thank Sydney and also the Global Health subsidiaries subcommittee and also our GHOCs and GMs for contributing their efforts into making this global health training come true. So I believe everyone must be very excited to participate on the following session. So I'll be closing my welcome words here and hope we all can have fun and enjoy the global health training today. Viva AMSA!
Thank you, Vicky, for your speech. Our guest speaker, Dr. Davi, has just joined our Zoom meeting. So welcome to our global health training. And we're really excited to hear more about your experiences. So now we'll be diving deeper into the webinar session, guided by our lovely moderator, Elvina. Elvina, the time is yours.
All right, thank you so much, Florence. Hello, everyone. Allow me to introduce myself. I am Elvina from AMSA Indonesia and also the Licensed Officer to Non-Medical Students Organizations of AMSA International this tenure. And I will be guiding you through our webinar session as the moderator. Now, I would like to invite our guest speaker of the day, Mr. Davi Romao. But beforehand, allow me to read his curriculum vitae. Okay, Mr. Davi Romao is currently a consultant of evidence to policy and impact units in the research department of the Health Department, Science Division, WHO, Switzerland. Davi Romao is also co-founder and former deputy executive director at the Veritas Institute, the first Brazilian NGO specializing in evidence-informed social interventions. He has also coordinated and supported the development of several evidence synthesis, evidence maps, and other initiatives to promote evidence-informed decision-making and knowledge translation in Brazil. Mr. Davi has also worked as a research coordinator at the Brazilian Ministry of Justice and as a research consultant at the International Initiative for Impact Evaluation and at the Center for Effective Global Action, UC Berkeley. He also holds a Master of Public Policy from the University of Oxford and a Master of Science in Social Psychology and a Bachelor of Arts in Psychology from the University of Sao Paulo. Without further ado, let us welcome Mr. Davi Romao. Hello, Mr. Davi. How are you?
Hi, everyone. Hi, Elvina. Thank you so much for the introduction and for having me here. It's a pleasure to be able to share a bit with everyone.
All right. I'm sure everyone is also very excited to hear your webinar, sir. All right. So before we begin the session, I would like to once again remind all of you that we will open the floor to the audience later after the talk. So if you have any questions for our guest speaker, you may type your questions in the Zoom chat feature or directly turn on the microphone. Okay, without further ado, to Mr. Davi Romao, the screen is yours.
Thank you so much, Elvina. Well, I'm happy to share some slides. I think I need authorization to share my slides. I guess the host needs to authorize me.
I think it should be possible.
Yes, thank you. Can you see my slides?
Yes, we can, sir.
Great, thank you. Well, hi everyone. It's an honor to be here with you all and a pleasure. Thank you again for the invitation. So I'll be speaking on behalf of the World Health Organization, and in particular on behalf of the Evidence Informed Policy Network. It's a network that works in this area of evidence to policy and knowledge translation. So I'll be briefly talking about the network first, and then dive in a bit into the topic of evidence use and evidence synthesis and policy briefs with evidence for policy. Please do feel free to ask questions. I might not be able to see hands or messages in the chat, but if someone has any issues, also feel free to open the mic and step in. Let me just put a timer here for myself so that I don't lose track of the time. And let's get started. So first, I would like to introduce a bit the EVIPNet. That's the network that the WHO hosts to promote evidence use in policy. And the idea there is to work with knowledge translation. So we are not necessarily talking so much about evidence production, so the research side, but mostly on how do we find, assess, synthesize the research evidence and translates that evidence so that it's useful, applicable, it's timely for the policymaking process. So the policymaking process is super complex. It needs to include many variables, factors. It has legislation, it has norms, it has social events that will shape the policymaking process. And what we want is that all these processes, all these steps, they are informed by the best possible evidence. And that's where the research evidence will come in. And for the research evidence to come in, we need these tools of knowledge translation. So translating the knowledge that from a research perspective is very abstract, is very technical. Academic papers are hard to read, right? I think everyone here has had the opportunity to struggle through an academic paper to get to know what exactly happened, what exactly they did, and what were the conclusions. So if you think about policymakers or stakeholders in the policy environment, they will often not be able to do that, especially if you have a huge volume of academic production. And that's where knowledge translation steps in to facilitate this process, to translate the knowledge to a new language that's the language of the decision-making process. So that EVIPNet is constituted by members from different countries, and we are very interested in expanding. So if any of you is working in a federal institution, a national institution, or ministries of health, and you're interested in expanding the work so that it strengthens this side of evidence use, feel free to reach out, and we would be very happy to include the institutions in this network so that we can share, so that we can build together and strengthen the culture of evidence use globally. So very briefly, the network has these four main goals: institutionalizing structures and process for evidence use, so that the culture of evidence use is made a routine in institutions. The widespread use of norms, standards, and tools, so that we know what we're doing it with high quality and in a systematic and transparent way. We want to strengthen capacity for knowledge translation and knowledge use, so that countries, institutions, health units, they can whenever it's necessary, they can easily access the evidence and incorporate that into decision making. And we also want to provide timely, relevant evidence for the policymaking process, so that whenever there is demand, this demand is immediately met with the right supply, so that decisions are more effective, more transparent, more economical. And ultimately, the whole point of all this is that the health systems are more reactive to the people's needs, and that we can promote better health globally. Right? So, cutting to the chase of the work we do, what is evidence-informed policymaking? So the idea there is that it is an approach, it is a field of work, it is an area of specialization, it is a collection of tools that promote the uptake of evidence in policy, so that policymaking is well informed, it's rigorous, it's sound and robust. And here you might have heard of evidence-based public policy, evidence-based policy, or evidence-based medicine. We emphasize the idea of informed because we don't want to trigger paranoia, basically, that the decision makers should copy and paste what the evidence says, what the researchers are saying, or that the evidence should be the final word when it comes to policymaking. We really want to emphasize that we understand, we recognize, and that's absolutely natural, that the policymaking process is complex and involves many factors. But we need evidence to be there. We need the decision makers to be aware of the best available evidence, so that they understand it and that they can balance it with these other factors in making a decision. That's why we put the emphasis on informed and not so much on based. But overall, it's the same idea, right? Yep, and we're going to be working to assess and appraise evidence so that it's a valuable input for the decision maker. And again, made in a systematic and transparent way. And this is really important for us. The idea that the processes that we are undertaking for knowledge translation, they follow standardized protocols that are rigorous and at highest quality. And also they are very transparent, so that anyone can criticize it, can evaluate it, can replicate it, can try it in their own context and update it if it's outdated, and so on. So for knowledge translation, I think the main thing that we need to keep in mind is that you have a diversity of tools, a diversity of methods, but you really need to stick to these two principles of being systematic and transparent, because that's what will give us credibility, that's what will give us robustness, so that our conclusions and recommendations are of value to the key stakeholders. So I was saying, we emphasize the idea of informed as opposed to based, because we have recognized that doing policy, making policy, depends on experience, political context, narratives, resources, and so on. And we want evidence to play a role there and to be strategic and central in this process, but also without disregarding other factors that are obviously important for policymaking. And where do we want to input evidence? Well, basically across the board in the policymaking process. So we want evidence to be a key part of agenda setting. So how a problem becomes a relevant social problem, how it becomes a political problem, how it is absorbed by a country's Ministry of Health or Parliament to become a priority within the country. We want that process to be informed by evidence. We want evidence to support the analysis of the problem, understanding the problem, identifying trends, magnitude, why it is relevant, and how it is played, how it plays out in the country. And we also want evidence informing how to deal with the problem, how to tackle it, how to intervene so that the problem is mitigated or sorted out. And that involves like identifying policy option, implementing it, monitoring, evaluating, replicating, scaling up, so on. You might have seen a version of the policy cycle around. We have many versions. This is the version that we use here at the EVIPNet. And of course, the policy cycle is a myth, or it's not really an accurate description of how policy happens, but it is a useful analytical tool. So we have these quote unquote steps or maybe dimensions of policymaking that they naturally will happen, even if they're not happening explicitly when someone is developing a policy, they will happen implicitly. So someone or a group of people will be identifying a high priority issue and will make it the issue to be addressed at that point. Someone will be designing solutions, choosing a solution, designing it, implementing, communicating, engaging the relevant stakeholders so that the implementation can move forward, monitoring and evaluating and adjusting whenever necessary, sustaining the change and making it permanent whenever suitable, discussing and incorporating equity concerns, and that closes the cycle and it starts again. In practice, this cycle doesn't happen as a cycle. It happens as dimensions that are overlapping throughout the process of policymaking altogether. It's very erratic how these dimensions are connected. But in any case, all these dimensions are present, even if not explicitly, and we want evidence to be cross-cutting. So we want evidence to be a source, a base for all these stages of the policy cycle. And then what are we talking about when we're talking about evidence? There are many classifications of evidence, many types, typologies to classify evidence. This is one that we like. There is no right or wrong there, but this is one that is useful for us from the perspective of evidence-informed public policy, in which we are considering first primary research, so observational studies, experimental studies, quantitative, qualitative approaches, for instance, behavior research, or the process of monitoring and evaluation. So these are basically approaches to identify and understand primary data. So what is happening in the world, we're describing phenomena in the world. Then we have a second level of evidence synthesis. So how do we put together these insights, these learnings from the primary research into products that synthesize the widespread availability of information. So for instance, rapid review, a scoping review, or a systematic review will synthesize the findings of many studies on a topic, right? And that is super useful because otherwise you are stuck with this huge literature that is impossible for a decision maker, for instance, to read. And finally, we have the tertiary research types or evidence types. That these are evidence products that are more targeting the action. So guidelines that will use the systematic reviews, that we use the experimental studies to describe what works, what doesn't work, and how we can incorporate these strategies into, for instance, our health system. Or evidence briefs for policy that we're going to be discussing today that lay out a policy problem, a health problem, and discusses policy options and interventions that can be chosen to address the problem in an effective way. So from the base of the pyramid to the top, we are moving from more concrete, more empirical approaches to more policy-oriented approaches or practice-oriented approaches that will use the data that we have gathered from the primary research and already translated into more decision-making mindset, right? Okay, so today I will be talking primarily about evidence briefs for policy, which I understand is the main focus here of the workshop. And the idea of an EBP is of a research synthesis that is user-friendly, that offers policy options, describes the problem, offers policy options, and that aims to convince the target audience, decision makers, key stakeholders, of like the importance of the problem. It is a relevant problem, it needs to be addressed, and how we can address it. So the options, the possibilities, the angles of attack, so that the policy problem is addressed. And I would like to emphasize here the idea of user-friendly. So it's not only about synthesizing, it's also about changing the language so that we are no longer stuck with a research academic vocabulary, but we are adapting, translating this vocabulary into a language that is applicable, that makes sense in the decision-making context that we want to affect. And that means, of course, changing from an academic writing style to an executive or policy writing style, but can also mean understanding the local culture, the local values, the local vocabulary, and understanding how we can frame these ideas that come from research in a way that our target audience, the people who will be reading this report, they can really familiarize themselves with the idea. They can understand what we're saying, and they can see the relevance, and so that the policy brief is already like a first step towards implementation, right? It's not only about communicating information. It's not only a vehicle, but it's really a springboard to facilitate action in as a next step. This is just to emphasize a bit the difference. Policy briefs are very common. There are many types, many methods to develop evidence brief. But at EVIPNet, we have this specific product that there are evidence briefs for policy. And they have a very specific methodology to be developed. I'm going to be talking about it briefly today, and we can share resources later on how to go step by step. We have guides on developing evidence briefs for policy. And the emphasis there is we really want the policy recommendations and the description of the problem to be evidence-based, to be rigorous, to be accurate, to be using the best available, the most updated evidence possible, and also to be conducted in the systematic and transparent way we've been, I was referring to before. So we wanted to be really transparent so that anyone reading the policy brief can understand what were the processes that we undertook to develop this piece of research or knowledge translation. And in this policy brief, we will be compiling or merging together both the global research evidence, so we will be looking at systematic reviews, especially for policy options, and the local evidence. So what are the equity considerations that we might need to make in this context? So costs, barriers, facilitators. We'll be putting this together to shape policy options. And that is an important factor here, because we don't want to provide policy options to a context where this option will be from the start, from the get-go, impossible. It just doesn't make any sense for this context for any reason. For instance, maybe a policy option that is super effective is not in line with the culture or religious values of a community. And then it's pointless to be insisting, pushing for that, right? It can even be offensive. So it is a product that is developed with the audience in mind all the time. So we have one eye in the research, one eye in the audience, and we're trying to put them together so that it is a rigorous piece of knowledge translation, but also applicable to the local context. The key components of a policy brief, we're going to have a summary of the evidence to clarify, to describe, to understand the problem. We will discuss policy options and focusing on the impact, what the literature says, reports that have been the impacts of these different strategies in different contexts. And we will also discuss implementation, and especially in the part of the implementation that's mostly local evidence, right? So what are potential barriers, risks, how these different options might affect different populations, how we can implement it given our policy system, the health units that we have available. So for instance, an intervention that requires reading, if part of the population is illiterate, that will be a major barrier, and it will also increase inequality, right? So we might be with an intervention that requires something that a group of part of our target population, they don't have that competency, for instance, reading. It might end up being an intervention that increases a problem of inequality in the region. I mean, that's something that the global literature on impact will not be able to map out perfectly for us, right? You can have, in a systematic review for a specific intervention, you can have broad considerations on barriers and risks and costs, but the components that are really relevant for our context or specific context can only be mapped, understanding the context, discussing with the key stakeholders of that context. Briefly, the structure, suggested structure of an evidence brief for policy. We started with key messages, and this is a one-pager that really provides the core ideas. And this is for someone that do not have the time to read through the whole report and will have an opportunity to have a sense of what the report says without putting too much time into it. Then an executive summary, a 3-pager that will provide a more detailed synopsis of the main segments of the brief: problem, policy options, implementation considerations. And then the full report that we suggest 25 pages. Longer than that, it gets too long for anyone to read. In practice, very often this full report ends up being larger. And you can always have the option of putting some information as annexes that, especially for instance, methodology or some description of processes, you can put them in as annexes so that people do not feel the need to read it, but also it is there for transparency's sake. Again, this is a suggested structure. As I was saying before, we really want these resources to be tailored to our target audience. So whoever is working on an evidence-preferred policy needs to understand in what way this structure will be a good fit to my context, right? And the context will guide the decisions more than this structure. Like this structure is suggestive, but there is flexibility there. The main thing that we need to keep in mind is that we want to convey the key messages. So if we're not conveying the key messages, the structure is not working. We need to really revisit it so that it is more effective. So I'd like now to pinpoint a few aspects on these main elements of problem, interventions, implementation, so that we have a broad view of what questions the policy brief will be answering. Right? So when it comes to the problem, what is a problem? How it came to our attention? Like what is the relevance of the problem, and what is it? How it's relevant for different stakeholders? So how we can create narratives that make the problem stand up for different people that might have different priorities. So a problem might be super relevant for association of citizens because they are really passionate about this problem, while from the perspective of the health system, it might be super important because it has a huge budget impact and they really need to cut costs. So you can have these different angles to describe the problem, and you can explore it in the problem definition so that we can spark the interest of the different relevant groups. That is how can we frame it in a way that it is appealing, right? And how can we describe the different consequences of the problem so that it sparks interest of these different groups. Problem definition often discuss the magnitude, so how big it is, how can you compare it to different trends, different benchmarks, what are the causes, so what is leading to the problem, how these causes can be problems themselves and might need attention in isolation, what are the main consequences, trends, and so on. So these are a few questions that we might want to answer when we are describing the problem. And again, these questions will be answered using evidence. So we'll be doing like quick literature searches, we'll be using institutional data. We can go back to the pyramid of evidence to see what types of evidence we have available and that can help us answering these questions. Here, there is no right and wrong. What we really need to do is, again, be systematic and transparent regarding how we're choosing the evidence that can answer these questions. And then we have the description of policy options and the implementation considerations that are associated with each policy option. So what can we do to address the problem? What are the possible solutions? For that, we're going to be looking in the effectiveness literature, especially systematic reviews that will be putting together the data from different impact evaluations, experimental studies, randomized clinical trials, for instance, or quasi-experimental studies. And these will tell us what interventions have been tested in multiple contexts and have been shown to be, on average, effective. And also, what is the variability that we see there, right? Some interventions might be super effective in some contexts, but not effective at all in others, while some other interventions are consistently effective across contexts. And these are ideal, right? This would be the gold standard, an intervention that, regardless of the contextual factors, always works, always achieves good results. So We will visit the impact literature and we retrieve that information, describing the policy options and describing to what extent they have been affected and to what extent we can expect them to be affected in this new context. And then also discuss this implementation consideration. So what are the possible benefits and harms? Have any harms been reported when implementing that policy option? What are the costs? How can we make a cost-benefit analysis to understand, to compare these different policy options and to compare it to the cost of having the problem to begin with, right? What adaptations might be needed? Is there acceptability? Would such an intervention be possible in our context, given our staff values, given the population values, given how our health services are organized? What are enablers, barriers that can play a role throughout the implementation process? And again, equity considerations, right? So how can these interventions either improve or increase inequalities and differences across different groups that are present in our context? To identify potential options, we need to consider, again, many factors, and to some extent, developing a policy brief will be an exploratory work, and to some extent is really the application of these standard super structured methods. So, for instance, we need to understand what are the causes of the problem, right? Sometimes what we are understanding as the cause or as the problem is not really where the core problem is. For instance, I was working once in a policy brief for stress among police officers. And while we were investigating the situation, the causes of stress among police officers, we understood, and there was an assumption there, a hypothesis that they were very stressed because of the nature of the work of law enforcement being very stressful. And while we were investigating it, we understood that actually most of the stress was coming from the hierarchical relationships within the institution. So the law enforcement part of the job wasn't really that much a source of stress for the officers, but the relationships, especially the relationships with their superiors, was often seen as abusive, as stressful in many different ways, arbitrary. So we understood there that, okay, what we have here, like it is a problem of stress, but it is better framed as a problem of organizational management, right? Or values and structure of human resource management within the institution. The hierarchical structure of the institution is leading to this problem. And then, so of course, we could develop an evidence synthesis on stress and how to mitigate stress in the work environment. But maybe it would be more interesting to develop an evidence synthesis on how to structure healthy hierarchical structures in an organization, right? Then when you have that mapped out, you really need to look at systematic reviews, overviews of reviews. Not sure if everyone is familiar with this type of studies, but these are the studies that will put together the insights from the primary research into one piece that provides this overview of what the academic literature has found in terms of effectiveness of different interventions. So they will do that in a very systematic way, a very transparent way, so that we can really assess the quality and the rigor of the primary studies. Another source of ideas is how other similar contexts have addressed the problem. You can also consult with key informants or stakeholders that will be able to point to where interventions could be possible. And of course, you can use brainstorming with the core team, with people that are more involved with the problem. Again, these are all possibilities, and they can be used as long as we are very transparent and systematic about how to do that. So preferably we would go for the systematic reviews, because that's where the more robust evidence is, and we can combine that with these other insights to make these policy options richer, especially better informed by the data and the circumstances of the context. So I've been talking about systematic review. Not sure if this is a familiar concept to everyone, but the idea is basically a study that summarizes the results of usually experimental primary studies, right? So you have, let's say, a set of 10, 15 randomized controlled trials about one intervention, about it could be a drug, it could be a policy intervention. And if a decision maker, policymaker, or a stakeholder wants to understand if this type of intervention is effective or not, and they need to dwell in these 15 studies, that would be just impossible, right? They would need to, for every policy question you have, someone would have to do a master's degree in that topic to be able to say anything. So the systematic reviews, they step in to help with that problem. They will map the literature for you. They will map it in a very comprehensive way. Structure, you have a protocol on how you will search for the literature and how you're going to retrieve the data, how you're going to synthesize, analyze the data, and how you're going to provide the conclusions regarding what the literature, the academic literature at that point is saying about that specific research question. So whenever possible, when developing a policy brief, especially when choosing policy options, we'll rely on systematic reviews. Systematic reviews might also contain a meta-analysis, which provides a new statistical treatment to the data retrieved from the primary studies, on top of the narrative synthesis that a systematic review also provides. And well, you have different dimensions that can also be present in a systematic review using qualitative data, using administrative databases. You have increasingly more systematic reviews of qualitative studies, so qualitative systematic reviews, overviews of systematic reviews that will put together many systematic reviews on the same topic. This is a growing field, so we will see definitely over the next few years many more innovations. And why are we talking about systematic reviews here? A few reasons. One, from the perspective of the policymaker, I was saying, it saves time, right? Instead of for each question you having to read dozens of papers, you can just read one paper that summarizes the evidence for you. This paper will provide information, again, in a systematic and transparent way, so that will prevent us from cherry picking one study, for instance, or misunderstanding the value of a study. Reduce the likelihood that policymakers will be misled by a single study. So this is very common. I'm not sure if someone here has had the experience of being in a policy environment or discussing intervention, and someone brings up a study saying, oh, we should do this, look, this study has done this, which is obviously relevant information and we should be taking it into consideration. But that one study might be flawed, might be very weak, might be outdated, might be one study among many others that says the contrary. So relying on one study and not having the skills to critically appraise that one study can be very risky from a policymaking perspective. And systematic reviews provide a tool to prevent that risk. And it provides confidence, right? So as the systematic review does that analysis in a systematic way and assembles the evidence across the literature, policymakers can feel more confident that those findings, that description is accurate, it reflects well or the best available evidence on the topic. Here I will share with you all, I can share the slides later, some websites, platforms where you can find systematic reviews. To navigate them in a proficient way, there are courses on literature search, using keywords, using the mesh words and Boolean terms. This is super useful, super interesting, so I advise if you guys didn't have a chance to develop that skill yet to move forward with it, because this can be applied in many contexts. In the health sector, you can constantly be updating yourself through these tools. And as a, not exactly a final, but one key step in developing a policy brief is to conduct a policy dialogue. So I was saying, right, that the policy brief will put together the global evidence, the systematic reviews, the evidence from the academic literature with the local evidence. And a policy dialogue is a very useful resource for that. So again, we have a very structured method for policy dialogue. We have a guide on that I can share with you all later. And through the policy dialogue, we will present the evidence brief or the preliminary version of the policy brief. And we will conduct this deliberative process, and by that we mean like a process where people share their views with a debate that's not necessarily leading to a conclusion, but leading to this exchange of perspectives. And through that exchange, we will understand how the policy brief and the findings of the policy brief resonate in the local context, given the needs, given the possibilities, the barriers. So the policy dialogue is actually, you can think of it in terms of two main goals. One is sharing the insights of the policy brief so that you increase engagement. And the other one is a data collection step, right? It's an opportunity to see how that academic output is, in what ways it is connecting or not with the local context. So it allows interaction and also allows for the findings of the policy brief to be refined given the local context needs and possibilities. Yep, so as I was saying, the policy brief, they will have this process of merging, putting together the global evidence on one hand, the local evidence on the other hand, and through that combination, providing informed, relevant, timely insights on how to incorporate that evidence into effective policies. So I'd like to share with you all an example of policy brief for us to close this session. This is a recent one. There we go. Yep. So the title that tries to very clearly describe what the policy brief is about. There is a bit of a work on the layout here. So the idea is for it to be appealing, interesting, not only another boring report, but something that draws attention. And then you can see here that structure that I had described, right? So one pager or two pager here with key messages, then a short executive summary, and then the longer report with the problem, options, and implementation considerations. As you can see, this one went over the specifications that I had shared before of 1.3.25, but that's fine. What we really need to be mindful about is that the longer it is, the less likely is that people are going to read it. So we really want to keep it as short as possible and focusing on the key messages. Here you can see how they define a problem, consequences, causes, describe three options for addressing the problem, and then provide implementation considerations. Yeah, so I believe that's the end. Thank you. I think I'm on time. I will stop sharing and we can have a conversation now. Sorry if I was rushing through the slides too much. Hope it was possible to follow.
Yes, it was very clear. Thank you so much, Mr. Davi, for the amazing session. And with that, the webinar session has come to an end. But of course, we're opening a question and answer session for the participants. So if you have any questions for Mr. Davi, you may type your questions in the Zoom chat feature or raise your hand. And if you would like to voice out your question, I will allow you to do so. Okay, since there's no one raising their hands, actually there are some questions in the chat box here from Chaitanya from AMSA India. So the first question for Mr. Davi is, are there any ethical considerations to keep in mind while preparing evidence-based policies? You may directly answer the question, sir.
Yes, definitely. I think it's an ethical endeavor altogether, right? So we need to be. I think we have ethics when it comes to the methods. So how we can develop the evidence brief in a way that is transparent, systematic, faithful, unbiased, that is respectful of the needs of the local context. And we also need to be ethical and have cross-cutting ethical considerations when it comes to the content, right? So to what extent this the way we're framing the problem is applicable, accurate, and it's reflecting the needs of the local population in a way that is that we're not letting anyone behind, or that we're not potentially reflecting social biases and leaving out important aspects that should not be left out. And that's especially prominent when you talk about equity considerations for the options, right? So as I was saying, some options, they might lead to further inequalities. They might tap into a process of social exclusion. And we really don't want that to happen. So it's very important that and for that we have this very short tool that's called Progress Plus. It's an acronym for ethical dimensions that we need to consider when doing evidence-informed public policy. I can share with you guys the link here. And that is basically dimensions of social cleavages that one can keep in mind to map these potential differences and equity challenges. Let me pull it up here and I can share in the chat.
We have received the link, sir, for the Cochrane methods of equity.
Mm-hmm.
Okay, so basically the answer is we have to look at the accuracy, applicability, and the needs assessment, as well as the equities, of course, and the social considerations. I hope that answers Chaitanya's question. I think we have some questions here, sir. So the next question is how to navigate through an issue, such as when stakeholders are reluctant to accept the change based on evidence-based policies because it will affect the existing practices. You may directly answer the question, sir.
Yeah, you need to face it and navigate like head on towards it, actually. So for instance, there was a situation in Brazil once, a colleague of ours, like one of the leading experts in evidence-informed public policy in Brazil, he conducted an evidence synthesis on how to prevent dengue, the viral infection. And they found out that this little fish can be put in different containers of water, and the fish eats the mosquito larva, and that prevents the spread of the disease. So they made an agreement with the Ministry of Health. They bought containers of fish to spread throughout the city. But then what they didn't realize or didn't anticipate is that the population of the city wasn't willing to have the fish there in their own water containers and spread across the city. So they faced a huge backlash, and in the end, I think most of the fish died and they couldn't use it because they had not, or they tried to do evidence-based public policy, right? They tried to like just let's do this because it tends to work, without having proper engagement with the key population, the target population. So that is an example of not working, right? Not doing it, actually. There was an important missing step there. And if you map that beforehand, then you can search for strategies to deal with this barrier. So each barrier can be turned into a policy problem. And then you can search strategies and develop strategies, policy options to deal with the barrier specifically. So maybe if they had mapped that beforehand, they would frame a problem such as, oh, how do I convince a population that a specific health intervention is beneficial for them? And then they might find evidence on communication of health interventions. And then they could develop a communication strategy to increase engagement. Right? So yeah, you're going to have to face that. And again, my recommendation would be to map these barriers beforehand and turn them into policy problems themselves, and then try to find the solutions for these policy problems.
Okay, so we have to consider the problems and find the solutions, and also formulate communication strategies for the public through the policy. Okay, I hope that answers the question. We also have some very many questions actually here, sir, that are very curious to ask you. So the next one we have from Reynardi, and actually the topic is aligns with Abbas, so we can fuse the question. So the question is, I have a question in regards to the policy dialogue. Do you have further tips or even recorded examples on making a great policy dialogue? And also, how can we make policy research into action, as you have to convince the policy makers? Thank you. You may directly answer the question, sir.
Sure. For the policy dialogue, we do have a guide and a checklist for policy dialogue, so I can share that later, and they have some tips and guidelines. I think it's really important, maybe as an additional consideration, just to think how you're going to engage the key participants in a way that you have those two goals accomplished, right? So you want them to have ownership with the findings of the evidence synthesis, and also to retrieve data from them, so that we can finalize or improve the insights of the evidence brief. And that's going to be very context specific. So for instance, I've conducted a few in Brazil. Brazilians are very talkative. And one of the strategies we had to adopt was to give people allocated time and really cut them off, so that we could ensure that everyone would have a chance to talk. I'm sure that in different contexts, if we're conducting a policy dialogue in Sweden, it would be much different. Like the problem maybe would be the opposite, that it would be harder to get people to share as much as we needed. So I think you can have that, again, this contextual mindset of how can we conduct this process in a way that is accurate, that is robust, but also that meets the specificities, the nuances of that context. I'm not sure if there is a requirement. Like often policy dialogues are done under Chatham House rules, so that people can share their insights without being worried about being quoted and exposed. I can look up if there are any recorded policy dialogues and share later. And sorry, what was the other question? There was a final one.
The final one was how to convince the policymakers and bring it to action.
Okay, yeah. I think then again, that's when the policy brief really is coming from the research side to the communication side, to the engagement and knowledge translation side. And that's why this is a piece of work that is in between, right? It's a bridge between these two roads. There are systematic reviews on how to communicate evidence, and I could also share that later. So there are a few insights on how you frame the problem in a way that is more appealing. But again, I think the main challenge there is this will be super context specific, right? So how can we frame the problem in a way that triggers attention, that sparks interest by the stakeholders, and that is about understanding your target audience, understanding their values, understanding their priorities, and framing the whole thing in a way that whoever is going to read it or participate in the policy dialogue will look at the content and be like, oh, this really is relevant for my life. Like, oh, if I engage in this process, I have something to gain myself, be it professionally, personally, or whatever. So there is a tactic there in terms of how to frame the whole thing so that it is appealing. Right? And that goes for the content and also for the format. So how you write it, you might want to have a more storytelling approach to it. You could develop parallel resources that improve dissemination, such as short videos, social media posts, having a communication or a communicator supporting the process can be super, super useful. And just one more thing about the policy dialogue. I think it can be challenging to do it for the first time because you're kind of lost. There are a lot of moving pieces and things that you need to consider, but it's not hard to do. And I think it's important to develop that skill. So please do go for it. And if you find someone that has more experience, bring them along so that they can support the process. But after one or two policy dialogues, you're going to be very comfortable doing it. And then you can easily learn from your own experience what are the things that work, doesn't work, what are the things that you can improve so that for the next times it runs more smoothly.
Okay, so it needs a skill. So for the policy making and policy dialogue, and also it has to be robust, accurate, relevant to the corresponding stakeholders, and we have to also bridge research and engagement, and also practice evidence communication. Okay, I hope that answers Reynardi's and Abbas's questions. Actually, we have several other questions here, sir. So there is a question from Jen from Indonesia. Hello, Mr. Davi. Thank you for your explanation. I'd like to ask, how does the availability and quality of data and research influence the development of evidence-based policies? Is there a minimum number of studies or research needed to determine whether the interventions or policies are the right ones to answer a problem? For example, 3 systematic reviews are enough to recommend an intervention in a policy. Is there any case where the evidence is not enough? Can you directly answer the question, sir?
Sure. There is no standard in that regard. And there's more like a principle, right? Of we are trying to use the best available evidence. And the best available evidence will often not be the ideal evidence. But we still need to move forward with whatever we have. To make sure that we're moving forward in a responsible way, what we really need to communicate is what is the quality of that evidence. So sometimes you only have one systematic review and it's a low quality systematic review. You have specific tools to assessing the quality of the systematic review. They're not super hard to apply. And you might find out that you have only one and it's a very poor quality one. You can still report the findings, but you need to emphasize this is a low quality review. It's only one review, or maybe it's outdated. It's like 10 years old. Therefore, this evidence should be taken with a grain of salt. Should be this insight should be incorporated carefully. If you have one updated, very robust systematic review, that's ideal. But and that one systematic review that addresses your question directly, that is the ideal world. Very often, you'll not find that. Sometimes you'll not find any systematic reviews on the topic that you're interested. And then you might pivot to 2 different approaches. One is go to the primary studies yourself. That is a bit challenging. You might, for instance, do a rapid review of the primary literature to identify relevant studies. This can be, it's more time consuming, right? So you need to be ready for that. A different approach is to tap into the adjacent literature for your policy problem. So maybe you are looking on for instance, strategies for dengue. You cannot find anything, but then you know that there is other infectious disease that is similar, and then you're going to be searching for that type of literature and bringing that to the policy brief. Again, you can do whatever. It's the best approach that you can map, as long as you very transparently report, oh, look, we could not find any systematic review on this topic. Therefore, we chose that pathway. This pathway has these strengths and these weaknesses. Whoever is considering this evidence, please be mindful of that. And then you can also do the recommendation of further research is needed here. So we do need either more primary studies or a proper systematic review on the topic. And that is really important to do as well, because we are talking about knowledge translation a lot from like research to the policy, but we also need to do, while we're doing knowledge translation, the opposite direction. So while we are doing policy, we identify knowledge gaps that can inform the research agenda of the country, of an institution. So mapping these gaps is relevant information for decision makers so that they know that this is an area of research that needs investment. And then this can be another outcome, another conclusion of the evidence brief.
Okay, thank you, sir, for the answer, and thank you, Jen, for the question. So, to recap a little, there is no standards, and we have tools to assess quality of systematic reviews. And if at some extent, when systematic review is not available, it can be challenging. So we have to consider referring to primary research and also do the recommendations as well as identifying the research gaps. Okay, so unfortunately, due to time constraints, we will have to end the Q&A session here. So Jen's question will be the last question. However, would you mind, sir, if we can collect and compile all the questions from the Zoom meeting, and everyone who's still curious through asynchronously through the WhatsApp? So maybe Ariel or Sydney will contact you. Is it okay for you outside this Zoom?
Yeah, of course.
Thank you so much, sir. Okay. So thank you everyone for the wonderful and interesting question, and thank you, Mr. Davi, for the answer. Before we let you go, sir, we would like to present an e-certificate to you as a token of appreciation. And we would also like to take a quick picture with you, sir. And so I will give the floor to the organizing committee to help with the documentation.
Okay, I'll be screenshotting in 3, 2, 1. Okay, maybe you can show Mr. Davi how to do the AMSA pose.
Yeah, sure. So our AMSA pose is like this, sir. Would you mind following the pose?
Okay, I'll screenshot in 3, 2. Okay, thank you very much.
Thank you, Andrea. Thank you, sir. Once again, thank you very much, Mr. Davi, for the wonderful session. I'm sure all of us learned so many insights about evidence policy. And with that, this is the end of the webinar session. So I will give it back to Florence. Thank you, everyone.
Thank you. So this is the end of our first global health training. So thank you very much for your active participation and your responses. We hope you had a great time learning about global health policy and looking forward to seeing you participate actively in the upcoming initiatives of the Global Health Subsidiary. To remind you all, we also have the workshop and finalization of the policy we created on the 15th of October. So don't forget to join that session because there will be an award for those who actively contribute to the policy-making process. And before we end the session, we have already taken a photo already, so this will be the end. So thank you and have a nice weekend.
Thank you very much again, Mr. Davi. For participants, please don't leave that. We'll be sending out the feedback form shortly in the Zoom chat.
Thank you, everyone. It was a pleasure.
Truly a pleasure to have you here, Mr. Davi.